Spectrum Health Zeeland Community Hospital would like to partner with you on this journey. This class is designed to help you understand what to expect during your hospital stay. Representatives from the hospital will contact you to prepare your medical record before your surgery. Patient access services will collect insurance and contact information. Smoking cessation promotes healing, decreases risk of infection, decreases breathing complications. We'll provide your basic care and hygiene items. You may bring your personal toiletries. Bring your cell phone, laptop, and chargers. Bring comfortable clothing to return home in. You may bring your favorite pillow or other sleeping aids. Leave your medications at home. Do not bring any narcotics into the hospital. Plan to use oxygen from the hospital and send any personal oxygen supplies and tanks home with your family. We can't store these supplies, but they will need to be brought back when you're ready to go home. If you use CPAP at home, bring your machine and mask along with you to the hospital. My Health is a program that allows you to access your medical records, including labs and tests. We encourage all patients to sign up for this free service. You can do this if you have email access. You will also be offered the opportunity to sign up during your hospital stay. Your belongings are checked and logged in our electronic system. For your own security, we encourage your family to take home anything you do not need at the hospital, or hold on to it until you return to your hospital room. When you arrive at the hospital, you'll finalize your registration with Patient Access Services at the front desk. A surgery nurse will escort you and your family to the pre-op area, where you'll put on a patient gown. A nurse will start an IV. Your belongings will be verified, and you'll sign any consent forms if they've not been completed. Your family will be able to stay with you in the pre-op area until you are taken to the operating room for your surgery. Visitors are limited to 2 at a time in the pre-op area. Other family can wait in the waiting area in the lobby. Surgery staff will show your family where they can wait to talk to your doctor after the procedure, and where they will meet you after you recover. On or before the day of surgery, an anesthesiologist will talk with you about the anesthetic medications they will use to block pain during surgery. The anesthetic medications will make you sleep through surgery. After the surgery, the doctor will talk to your family in the waiting room. Generally, the wait time is 1 to 2 hours. Our team will take you to the operating room in your bed. Your surgeon will explain what type of incisions you will have. In the recovery room, you'll begin to wake up. You'll be transported to your room on the 2nd floor in your bed. Here you see one of Spectrum Health Zeeland Community Hospital's private rooms with a private ensuite bath. You'll continue walking through the night. Walking helps to circulate your blood and fully inflate your lungs. Your head will be elevated at a 45-degree angle. The head of your bed will be positioned to help you keep at this elevation. You may wear oxygen the first night. If you have sleep apnea, you'll wear your CPAP. You'll have a clip on one of your fingers that will measure your oxygen level in your blood. You'll use an incentive spirometer to help you cough and deep breathe 10 times every hour while you're awake. All of these measures will help keep your lungs fully inflated and prevent pneumonia. You'll be given a blood thinner injection up to 3 times a day to prevent blood clots. Get moving and stay moving. You can expect to have pain, especially in the first few weeks. Your physician will order medications to help control your pain in the safest way possible. It is also common to have nausea after surgery. Your nurse will tell you the purpose of your medications and the common side effects. All medications have risks and benefits. The top 2 side effects of pain medication are ineffective breathing and stomach irritation. If you think you are experiencing any side effects, it's our goal to minimize them. We want to give you the right medication to keep your pain under control. Your nurses will ask you about the level of pain before and after you're medicated. They'll also check your pain level when they check your vital signs and after any activity. Please ask for your pain medication when the pain is starting to get worse. Don't wait until it's out of control. Pain plans. You and your nurse will discuss how or when you will get your pain medication. Use medication around the clock so that your pain will be controlled for activity and rest periods. There's a whiteboard for communication in your room. It's used to help you keep track of your progress, your last pain score, your medication, and when your next pain medication is available. We'll also encourage other non-medication techniques: moving and turning, deep breathing and relaxation, music, and warm blankets. Please refer to your notebook called Navigating My Journey, given to you by the office. Please look under Nutrition for specific diet instructions. Bedside report. A nurse report is given at your bedside at change of shift. Hourly rounds. Hospital staff will come in your room every hour to check if you need anything. We include the 5 T's: toileting, tidying your room, turning or repositioning, tolerance to pain, and making sure the technology, call light, is within your reach. You'll be seen by a medical social worker during your stay. They'll assess if you have support available during your initial recovery at home, and if you have any discharge needs. They'll discuss support group options with you if you are interested. Going home. For example, if you have surgery on Monday, you're usually able to go home on Tuesday evening. Your doctor will write an individualized discharge plan developed just for you. Your team will help ready you by reviewing the instructions on your discharge plan. You will take a copy of the written discharge plan home. This plan is important. You can refer to it for questions, and you should keep it in an easily accessible place. You'll need to make arrangements for your trip home. You'll take a copy of the written discharge plan home. Keep your instructions handy, as well as the magnet Recovering After Weight Loss Surgery for quick reference. Your discharge instructions will guide you through the rest of your recovery at home. Liquids can include protein drinks. Flavored liquids that have less than 10 calories per 8 ounces per serving are acceptable. Decaffeinated coffee and tea. Chicken, beef, or vegetable broth. Sugar-free popsicles and gelatin. You cannot have regular soda, diet soda, carbonated beverages, or alcohol. And you cannot use a straw. You will have diarrhea. Call the doctor's office if you have diarrhea more than 4 to 5 times per day. Don't worry if you can't meet your daily goals immediately. Work toward it. Focus on hydration. Your best resource for diet instruction is found in your Navigating My Journey notebook under the Nutrition heading. Take time to rest and heal. It's best to take it easy for 2 weeks after your surgery. You can lift what you can comfortably pick up with one hand. You can begin activities such as going for a walk as soon as you're able. Remember, the first 2 weeks after your surgery are about healing, not weight loss. Once you get home, gradually decrease the amount of pain medication and how often you take it as you are able. If you have nausea, increasing the time between medications may help. Call your physician if pain or nausea is severe and doesn't improve. Within 24 to 48 hours after discharge, you can expect to receive a follow-up phone call from the hospital. We want to continue partnering with you in your health and follow-up in the coming years to help you be successful. Thank you for choosing Spectrum Health Zeeland Community Hospital.